Welcome back to the Sick-Witted Podcast. I'm your vibe mistress, Stephanie Renee, and on this episode, we're going to dive into one of the wellness subjects that far too many of us are battling, yet remains one of the seldom discussed topics among our peers. That is diabetes. Just a generation ago, type 2 diabetes was thought about as a disease of old people with no self-control of their diets. Amputations were commonplace, and many of us self-righteously thought it would never knock on our doorsteps. But today, we can rattle off a long list of young adult and middle-aged celebrities who have either succumbed to the disease or its complications. And we need to talk about it so we can reverse this alarming trend. In this conversation, we have enlisted the expertise of DANY Bourjolly-SMITH, who serves as a benefits manager for the City of Wilmington, Delaware. We discuss her family experience with the ravages of diabetes and how she advocates in her professional capacity for employees to get everything that they need for proper treatment of this disease and many other conditions. Listen, learn, and let's get better together. Greetings, everyone. This is your vibe mistress, Stephanie Renee, ready to welcome you back to another edition of the Sick-Witted Podcast. As you all may know, if it's your first time tuning in, the short version of the story is that our creative community in particular, but people of color especially, need to be having more conversations about how we maintain or protect our wellness and get along the journey to being there if we have a ways to go. And there has recently been sort of an uptick in more of my peers in particular who are passing away from preventable disease. A few weeks ago, we got word that producer Irv Gotti passed away from complications from diabetes. And so I knew that that meant we needed to have a conversation. And I'm happy that one of my good friends, a fellow Penn alumna, volunteered to embark upon this conversation with us. And her perspective is important because we often talk about how do we afford care? And the conversation we should also have along with that is how do we afford not to take good care. So joining us on today's program is DANY Bourjolly-SMITH, and she is a benefits administrator for the City of Wilmington, Delaware. DANY, welcome.
Hi, how are you? Thanks for having me.
I'm so excited to have you because I know that diabetes is a word that we are used to hearing all the time these days, but I don't know that enough people are paying attention to symptoms. I don't know that people really understand now that we're outside of the COVID pandemic, when we talk about underlying conditions, you know, how serious that is and its impact on us. So I guess we should begin from the personal place because this is a disease that has affected your family in a real way.
Yeah. You know, I used to think of diabetes as an old people's disease, right? And so, you know, we often heard our, kind of grandparents or our family members saying like, oh, she has the sugar, right? And I actually thought it was kind of automatic, growing up, my family had high blood pressure. My father developed type 2 diabetes. And my grandmother had type 2 diabetes as well, but it wasn't as talked about. It was just sort of like, oh, she's older and she has diabetes. This happens with old age. She would always say, I like to mix my salt with my sweet. Right. And so we often think about, diabetes being sort of like just related to sugar, and it's so much more complex than that. But that was as far as my understanding went. My grandmother passed away while we were at Penn, and she had a stroke. And it took me really just recently, as I kind of got into exploring diabetes and understanding it and advocating for it, that, she really had a diabetic stroke, very similar to what happened to, Irv Gotti. And when my father didn't, die away from type 2 diabetes, he had COPD, which is a whole other podcast. It greatly affected his life. Diabetes and the progression of it is really, it's hard to watch, right? It really, really takes away from your quality of life. And that was the last 15 years of his life, unfortunately.
Wow, 15 years. So, I think this is the reason why this feels more personal to me is because in the Black community and Latino community as well, it's so prevalent. Diabetes is so prevalent. And we are in a culture where there are a lot of people who go, well, I'll just take a pill for that.
Mm-hmm.
But the long-term effects of how it impacts our organs and other measures of our quality of life are really significant. And I say that as we begin this conversation, because when I was back home, when my father's health was failing, I was teaching in creative writing in a program. And it's just, when you're that after school space, kids, that low sugar, the attention goes all the way. So I got used to doing little things like maybe bringing in hard candy or donuts or something, just that quick sugar to give them a little boost at the end of the day. And I never thought about the issues with that until one day they were having their donuts and one of the kids said to another one, they're like, you're not supposed to be eating that. And I was like, why? And he's like, because I have diabetes. And I'm like, boy, why are you sitting up here just eating this like it's nothing? And he's like, that's what the pills are for.
Oh, gosh. Wow.
14.
14. And, actually with that age, you're not sure if he actually had type 1 or type 2, right? Exactly. And, they used to call it juvenile diabetes. But, but it's interesting, though, right? Like we just think, a pill can cure everything. And it's just interesting to hear a 14-year-old, I was going to say, like, I actually, we have parents that have diabetes, right? And so like, are we just the old people that I used to talk about? And that's just where we are in our age group. Have we gotten that old? But I just think it's so much more prevalent, I just have just been shocked to see, people, Black people, frankly, who are in their 40s, their 50s, and even their 30s. And when you talk to them, they have type 2 diabetes. Yeah. And it's, one of those things that are very hard for people to talk about, right? It's a lifestyle disease. It's preventable, right? Yeah. I mean, there are certain things that you can't get away from, right? Genetics, if you are of a certain age, if you are of a certain weight, if you're of a certain race, right? And we fall into all of those categories.
Right.
But you can control it with lifestyle and you can prevent it. It really is a preventable chronic condition. And I just think our lifestyle and our culture is not set up to do the work, right? It has to be your own personal journey to do the work that helps you either treat it and live a healthier life if you have it, or to prevent yourself from having it. And so, for me, beyond that, just kind of knowing that my father and my grandmother had struggled with it, working as the benefits director for City of Wilmington, largest city here in Delaware, I was just like fascinated by, the information. I had access to data that I otherwise would never have, right? Just because of the function of my job. And I just couldn't believe it. People walking, into the emergency room with end-stage renal failure, just completely untreated, right? Right. And then, other people just, the prevalence of, what they call pre-diabetes.
Yes.
Was just enormous, right? So then I did the work that I need to do, got myself tested. My A1C was a 5.7, I was very highly pre-diabetic, right? Like a borderline. And, I barely even knew what it meant. And, I worked in healthcare, I worked in benefits, right? So there's just a real call to action, I think, for us to sort of, one, be our own advocate, our own, patient and health advocate, and just even to just be more aware, right? We take so much for granted. And, the only, one of the pluses to COVID, I guess, is that people had to be more aware for themselves. And if it started with COVID and preventing that, and it went into other things, I think that's the benefit is, I think, like, across age groups, people are talking about everything from these preventable chronic conditions all the way to mental health, I think, which is one of the things that, preeminently is okay to talk about now in a way that wasn't before.
Yes. Well, there's a lot, I think, for us to process. One, I'm trying to remember what we were talking about specifically, which disease we were talking about specifically, but somebody said that whatever this disease is that has been on the rise in our community recently needs a better PR director. Because breast cancer has a great PR director, and you can't turn anywhere without seeing a commercial that's talking about the importance of being tested and that kind of thing. And though many of us are familiar with the term diabetes, the trickle down effect of what it does to your body needs a better PR director, I think. And we've had enough, when we talk about our generation, we're talking about Martin Lawrence, we're talking about Fife, we're talking about, Irv Gotti for sure. I know that was one of the things that Heavy D was concerned about before he passed, and he didn't die from it. But we think about, if you have these diseases that go untreated for extended periods of time, it also makes you more susceptible to other things that can greatly impact your life. And I'm surprised that maybe part of the PR that we don't have in our community now is that when we used to hear about our grandparents getting it when we were younger, there was almost an assumption that they were going to lose toes, that they were going to lose a limb.
Yep.
And that isn't as widespread, I don't think, anymore. But what else is going on internally that we need to be concerned about?
Listen, my blood pressure was through the roof. My cholesterol was through the roof. I, despite, just any, sort of like awareness, like I got up from COVID, I got up from this chair literally, and it's 30 pounds heavier, right? All of that, all of that has a knock-on effect, like the connectedness or whatever the word is of all of these things. And where they lead is it's just amazing, right? And so a lot of times, when I started advocating for diabetes at work, right, I felt like strongly as an employer, hey, I can advocate for myself, but maybe I can help like a lot more people, right? I have 1,000+ people on this health plan. Maybe how can we just at least raise awareness, and so we can change our language, right? Like a lot of people are, I used to call myself like just very like medically ignorant. If I went to the doctor for a physical, I did that, and I don't think I even fully understood my results unless there was something sort of like glaringly wrong. Right. And so we just keep going in the loop. We just go in the loop. And so it's just become so much more important to be aware and, to, sort of take action. Like don't go get the blood work, understand the blood work. Right. And when you're, told you have high cholesterol, you're told this, you're told that, just don't accept the pill, go further, go the step further for yourself.
Yeah.
And there's so much of it, like even cholesterol medication, you don't actually really need it if you change what you're eating. Right?
I think that's a huge thing for people to wrap their brains around. And let's face it, we talk about a pill for everything. The medication that people used to take to help manage their diabetes is now widely available for people who are just trying to manage their weight. So I think mentally there's also a disconnect about how all of the conditions that lead to type 2 diabetes are the things that you are regulating in your body to keep your weight down. So the susceptibility, I guess, of not taking all of those factors into consideration and thinking that as long as I'm doing this one thing, that I'm fine is an issue. Another one of our Penn alum used to say a thing that I just thought was funny at the time, but I realized how true it was. Quasimodo Ndakwa used to talk about being skinny fat.
Yeah. Yeah.
And I think it's really important too, because we were talking about obesity is clearly something to be concerned about in terms of it being a precursor to diabetes and all the things that go along with that. But this idea of fitness, I think, is something else that we really need to take into consideration, because there are people who are at, I guess you could say, an appropriate weight, but their body mass, like there are other things going on with them that make them more susceptible to diabetes. And there are people who are heavy, but their numbers are great. And so you cannot judge a book by its cover. You really do need to understand those blood work numbers as you described them.
Yeah. And, I want to address that, right? Because this whole, like, with the whole, weight loss medications and, how it started off. It's true, right? They did start off as medications for diabetes, right? And they found that, so a lot of times if you're diabetic, if you're pre-diabetic, they will tell you need to lose weight, right? Just losing 5 pounds can actually sort of reduce your risk and your complication by, over 13% for every 5 pounds. Like it's actually tremendous just what weight loss can do, right?
Yeah.
They add the exercise to it. Again, tremendous what you can do to actually really help yourself and, like not only the progression or just even the onset, right? And so I'm happy to share, I'm willing to share that I have been on the weight loss medications. I have struggled with my weight all of my life, different forms, different levels. And I think, honestly, the medications get a bad rap. And this is just my perspective, right? Which is that, for me, it was a time bound situation, right? And I think, to be clear, I don't think there's anything that's one clear fix. And I want to describe what my experience has been like on the medication. Because really what I was trying to do, I had a fear of developing diabetes. I also had some real concerns about, when I turned 50, and that 30 pounds I mentioned to COVID, add another 20, right? Like I couldn't believe directionally how I felt like I couldn't stop it.
Yeah.
Was I doing everything that I needed to lose weight? Absolutely not. But I was doing some of the things, right? And so here I was advocating for everybody to, eat healthy, do this, lose weight. And I just was going in the opposite direction. And then in 2022, I lost my kidney, right? And it was partially a result of COVID, but they kept testing me for diabetes, testing me for like nothing else, right? And it took them actually a long time to figure out what was wrong with me, because I was a Black woman of a certain weight, of a certain age, and they're like, clearly it's diabetes. Like, what could possibly be wrong? Well, again, as a Black woman, another, sort of disease or issue that we, could talk about at another date is that I had fibroids. So I had 26 fibroids removed. And because I had so many, I just ended up having like a fairly invasive surgery, and that scar tissue grew like around my right kidney duct and shut it. Um, and so when I lost my kidney in 2022, it was sort of like a call to action again to like lose weight, make some lifestyle changes, right? But I was just struggling like just with a lot of things, becoming a new mom during COVID, and we weren't really quite out of COVID yet. And I felt like I needed help, right? Like I felt like I've done, there are diabetes prevention program. I've done them 3 times, and I would lose weight, get back to, gain the weight. And so I'm a huge advocate of prevention. I want to be clear, right?
Yeah.
But it was, it got to the point for me where I felt like it was really time bound, right? So when I lost my kidney, I also found out that I had 3 hernias. Right. And my surgeon pulled me aside and she said, hey, just so you know, like we can't fix all of this at the same time.
Yeah.
But if you just lost some weight, you would actually, you could actually reduce your need to have another hernia surgery, which is kind of really not great because of where I have them, because you have fatty tissue coming out of your hernias and not like intestines, like organs, like other people.
Yeah.
Right. And so again, here's this thing again, Donnie, lose weight, Donnie, lose weight. And I tried, and it just, the perimenopause, menopause, like I just felt like the deck was stacked against me,
Yeah.
Including my mind, right? Like I was having a hard time staying on the path, right? And so, the weight loss medication has helped me tremendously. I do not think it's an easy out. I don't think it's an easy fix. I think it's important to have a really qualified medical professional treating you, and that's one of my issues and why I'm actually like willing to talk about what I've been going through medically, because there's such a pervasive need. It's not actually as widely available as you mentioned, right? A lot of people are going and doing this like off-label type of thing, like it's not real medicine, right? Like it's not. And so my health program covers it. So I'm getting it medically. I have a great Black physician that I'm working with, and I'm not speeding my way through. But in the time that I have been on the medication, I've lost over 70 pounds. I've gotten off my cholesterol medication. I've been able to get off one of my blood pressure medications. I'm probably going to have to be on one forever, right? Because of like the one kidney and regulating that function.
Yeah.
I got off my depression medication because that was real too. And I feel like I have prevented myself from going down a path that I think would have been hard to untangle the mess that I was weaving, right? But one thing I will say, and why I think prevention matters, is that it's not just a quick fix for me, right? It's these prevention tools, these resources, and these guides that I picked up along the way has helped me, right? Because even though the medication is doing some of the work, a lot of people are not clear. And this is true of bariatric surgery, it's true of these medications. There
Absolutely.
is work for you to do as an individual, right?
Yes.
So if I get off this medication, I'm just going back to, drinking a lot of wine, eating eating, at McDonald's and doing this thing, the weight comes on. It does not come back on if you're employing healthy habits, right? So
Mhm.
whether you're in a prevention program, you're taking medication, you're recovering from bariatric surgery, the work is still there. So whatever your tool is, there is still work we have to do as individuals, and it's critical, right? It's critical as preventing it, it's critical as managing it, and all of those things. And so I'm very aware of what I need to eat. I'm very aware of how much I need to exercise. Do I get it right every day or every week? No. But I now have tools that I can use to employ, right? And
Mhm.
started off with education and awareness. And now it's, I'm trying to put those things into action. And um, it's just as important as taking the pill. Yeah, right.
For sure. Ooh, that you gave us a lot in that. First of all, congratulations to you for having such a robust dialogue with your medical team
Mm-hmm.
to identify all of the things that were contributing to how you were feeling, let
Mm-hmm.
alone how you look, what was going on, how
Yeah.
you were feeling, because
Mm-hmm.
a lot of us do not honor when we're not feeling good.
Yep.
Right? Not feeling good is an indication that something's not right, but we're afraid to go talk about it. We're afraid to go investigate it and get properly diagnosed.
Yep.
So kudos to you for being aware of your family history and knowing that you weren't in a good place and
Mm-hmm.
getting treatment for the things that were affecting you. And then this notion of the good trickle down effect, right? Of
Mm-hmm.
being able to manage the weight. And then all these other benefits came out of doing the work to manage the weight. That's something that people need to hear. And first of all, if you don't have great health care,
Yeah.
the drug treatment is expensive.
Yeah. Yep. Yep.
And people need to be clear about that, because even if they think that this is the direction I can go in and I can make that happen, they need to understand that the out of pocket costs can be significant. So I want to come back to your role as a benefits director,
Yeah.
because I think this is important. You are managing a plan where people have this as an option because it's included, which is wonderful.
Yeah.
um, but the how do people, because we don't ask enough questions generally, so how should people who do have insurance, and hopefully good insurance, how do they reach out to their benefits director? Like, what is the sort of protocol for
Yeah.
investigating what options you have and how to take advantage of those?
So, what I would say is that my role as a benefits director is to provide the coverage,
Okay.
right? Your role as the employee or the patient, it's really stuff. It's as simple as calling the back of your card,
Hmm.
right? And so we think about that. We use our medical card like in case of emergency, like, or you go to the doctor when you finally go to the doctor and you're like, hey, do you have the same insurance as you had last time, right? And they take the card, they take the front and the back. And then, again, we think our work is done. And so that number on the back of the card can take you where you need to go. And it simply is, pushing the right buttons and just asking about your coverage,
Mhm.
right? And a lot of times, what we find is like a lot of people don't actually like to call their benefits director. Like I'm very accessible, right?
Yeah.
But a lot of times it feels like a private issue. Like I don't want to talk about my weight. This is again one of the reasons why people don't talk about type 2 diabetes is because they think it's preventable. I did this to myself. I don't want my employer to know. I don't want my employer to know that I smoke. I don't want my employer to know that I drink, right?
Yeah.
It's all of these things. And so that's what those things are set up to do. It's not just to like address a claim, and it's not just to find a doctor, it is also to find out your coverage,
Yeah.
right? Now I will say that in terms of the work that I do, and I speak on this a lot, and I speak on it from the employer perspective because I feel we have an obligation to cover these medications, right? This idea of meeting people where you are, bariatric surgery back in the day, 25 years ago, was not easily covered.
Right.
Now it's just become a lot more commonplace, right? Now there's all kinds of ways like the sleeve and the band and all this kind of stuff. So it's much more common, right? So why is the issue with covering these medications so difficult, right? And again, it has to do with how you're using it. I'm not an advocate. I'm not a fan of the people who are using it because they want to lose 10 pounds for their wedding. For me, it was a medical necessity. No, I don't have diabetes, but I went from 5.7 to 5.1, right? But it started off because we had diabetes, that the metformin was not working, right? That pill that we always were, is essentially what we were talking about.
Yeah.
It was not working. And so they have developed these medications, that have really helped to, again, reduce, like just the progression and the effects of diabetes. And when they found out that it was working, they were like, why don't we apply this to people who are pre-diabetic? Like that was sort of the start of it, right? It's kind of gotten out of control with like so many things that become trendy in healthcare, fen or, the keto diet, like there's all these trends. Right. And so I feel like, just this one particular medication has such a negative connotation to it. Because I guess you could say it's like as quick fix as anything else. Right. But one of the things that, I have been advocating for is, as employers, treating people as adults, right? So it's not for me to tell you I'm not going to cover this because I think it's too expensive.
Right.
I'm going to cover it because it's the right thing to do. The way I cover all diabetes medications, the way I cover, different types of specialists and providers. And I think if you have the right coverage and you have people who are now advocating for themselves, they're going to use it responsibly.
Yeah.
Right. You have good doctors that are prescribing it for the real reason. Right. There are some doctors that are, providing Ozempic and it really should be Wegovy or what have you. And that was more of like a supply thing, I think. But I believe strongly that you should use your benefits. And it took me too long to, as the benefits administrator, to use the benefits that I had, which are pretty great. But I will tell you that I started covering it for my employer because I was trying to cover fertility. Right? So, like, again, another one of those things, but it was driving me bananas, right? That it was an option whether we had to cover fertility, right? And we think about how we make families today and what a family looks like. How dare we consider not covering that for women, right? And it was never a question to cover Viagra. It was never, frankly, we were already covering gender reassignment surgery. Nobody wanted that smoke, right? Like, hey, let's just cover that. But when it came to women and women's health, it was like a big thing. So what actually happened is like I covered everything. I was like, you know what? We're just going to cover everything. And I'm going to make it my job to show people how to use their healthcare. Right. And so we were, actually very wildly successful. And, so the work I've been doing is actually speaking not just with like employees and potential patients, is actually speaking with other employers to tell our story and to encourage them to take that type of responsibility and action, because then you just help more people, right? So we're it was a small to mid-sized city. We have 3,000 covered lives. But what about those larger employers that can now cover these medications, and affect 5,000-10,000 people? And it actually started off too, not just with covering the medication stuff, and it was like people weren't even covering the prevention programs. They're $450. $450. Why would you put that responsibility on your employees, right? And then you're going to still make a big deal about medication. Well, cover the prevention program. Let's start there, right? And so we do all of it. I think it's important.
That's such an important story. I mean, and what you're saying, I hope that our listeners will appreciate. Staying silent can kill you. On any side of this equation, staying silent can kill you. You need to speak up if you're not feeling well. You need to ask the right questions when you do journey in to speak to a healthcare professional about what's going on with your body. And you certainly need to make sure that you are maximizing what your coverage affords you. You have, when you're fortunate enough to have healthcare coverage. So all of those steps are incredibly important. And what you just said as a benefits administrator also brings up the realities that we don't want to sugarcoat, the realities that it requires a squeaky wheel to make sure that the right things are covered for people. This idea when we talk about pre-diabetic diabetes and the fact that it took our previous presidential administration to cap the cost of insulin. But right, insulin is the treatment when you already have it.
Yep. Yeah.
We need to be more in the prevention business.
Mm-hmm.
And making sure, as you said, that we stop it before it gets to this point, so that people live rich lives, rich, long lives, as much as possible, because they're doing everything in conjunction with their health care and with their health professionals to have that high quality of life.
Mm-hmm. Absolutely. And, we've kind of touched on it a little bit, but that idea of advocating for yourself, right? So, that advocacy extends to, when I found out we weren't covering these things, I was happy to cover it. But, we ended up offering the prevention program on site because our employees were saying, hey, it's just hard for me to get to the location. Mm-hmm. But if it was here, I'm more likely to go, right? So there are different things we can do as an employer, and hopefully you have an employer that that will listen. At the end of the day, you have to listen to yourself, right? Like it took me too long to be my own patient advocate to, I wasn't like MDing my way through things, right? It just actually wasn't doing anything. Mm-hmm. But, I really believe that I would not have lost my kidney if I advocated for myself earlier. So it was, what happened with my kidney was like beyond rare and unusual. But when they found out what was going on with my kidney, I not only had a kidney infection, but I only had 12% function left in that kidney. Wow. And the pain started during COVID. And, at the time the hospitals were shut down and, whatever. And, COVID was one of the things that actually created like a severe increase in chronic conditions, right? Yes. Because people held off for 2+ years addressing it. But the doctor just kind of kept saying like, oh, you could go on this, we could give you that, we could, and then I just didn't follow up, or the doctor was sort of like very like nonchalant about what was going on, like no real level of concern. Yeah. And the pain started in 2020, and I had my kidney removed in 2022. So what happened in 2021 that could have made the difference for me, right? Yeah. I live in constant concern that I have one kidney left and I can't afford for it to fail. Right. So, again, I've had to take different measures for myself because that's how I wanted to advocate for myself. Sure. But, I see it with my child and advocating for him. My mother's in her 70s now, advocating for her. My sister does, a wonderful job, just ensuring that we have the care for ourselves, but it starts with us. Yeah. And, I will say, I guess a little bit of the same but different topic, but, what led us to this conversation was Irv Gotti, right? But, yeah. One of the things that made a tremendous difference several years ago was Black men or Black people willing to have their colon checked. Mm-hmm. Right. And so the conversation was sort of like hovered around like, hey, we tend to, have prostate cancer, right? But they've actually reduced the age where you should start looking, having colonoscopies and things like that. It used to be 50. They've reduced it to 45 specifically for people of color. Mm-hmm. And what happened with Chadwick Boseman not only was shocking, but again, there was that call to action. And so, I don't know, I feel like it's not the same call to action yet. When it comes to diabetes, I think there's something still sort of like ingrained in us culturally, like this is just going to happen to us naturally. Mm-hmm. But we don't let other things happen to us naturally in that same way, right? Especially when there is so many different options for treatment, right? Cancer is still really hard to treat, right? There's, just the way I can describe medication and surgery and prevention programs for diabetes. It's just not the same thing when it comes to cancer, but that is still considered a chronic condition. Yes. So the best thing that we can do for ourselves with cancer is early and frequent screening. That's all you can do. You can just stop it as early as possible, right? So the health disparities when it comes to any of these things is just really real for people like us. And again, I just think it's so worth talking about. And I feel like, one of the things that I'm grateful for is that we're so much better, at least as like our age group, like we're so much better at least having the conversation. Yes. It just kind of like, hey, this is what happens. Like, or you just talk to your family and, oh yeah, my grandmother has diabetes. My grandmother has high blood pressure. Like, well, that's not actually okay. Like it could be preventable. It could be treated.
Yeah. Yeah. The not throwing our hands up and treating things as a foregone conclusion is incredibly important for our survival. And I think in times such as these, when everything that we thought we could depend on or that was just ingrained into our society is now being called into question and in some cases done away with.
Yeah.
I think it's even more important for us to be having this conversation and that you gave some time today for us to address this, because it is really important for us to reconsider in all the ways what it means to take good care of ourselves.
Yeah. Yeah. And I would like to add too, there are certain things like we've talked today about prevention programs. Is your employer covering it? How do I find out if I have the coverage? Is this right for me? Should I have surgery? This and that, right? The one thing that you have is yourself, right? And so no administration, no healthcare provider can cover that or take that away from you, right? At the end of the day, we have to continually advocate for ourselves and do the work to think about what is a healthy diet for me. What does exercise look like for me? What does stress and self-care, if you will, what does that look like for me? That's where it really starts. No matter where you are in that journey, or what tool you decide to take, the greatest source of change is you.
Absolutely. Well, that to me sounds like a period on a sentence. You get no argument from me in that respect. Donnie, I thank you so much for taking out time today to address this. And if there's any resource that you would recommend for people who want to, I guess, better understand their numbers or anything, is there a website or a phone number that you might recommend to people?
Yeah. So, some of those websites got taken down. Like, honestly, literally, I've actually been in conversations about getting new information up because a lot of those resource tools that come from the federal government were taken down. So one, I say, start with, if you are insured, at whatever level, start with that number on the back of your card, and whatever the corresponding website would be. But check out, like the CDC, and things like that, and use that as a starting place for information. I'm happy to talk to anybody and share what information that I have. But again, I think, if you're insured, that information is still readily available to you, regardless of, sort of like what's going on very scarily in the world right now.
That's wonderful. Well, thank you again. And we'll make sure that we put some of these suggestions in the notes for the podcast episode. And as things continue to develop in our world, I hope that we have an open door to sort of call on you again to maybe analyze some of these things that are happening with regard to healthcare nationally.
I appreciate it. It's been so wonderful. I think these conversations are so important, and I really am grateful to you for having me on today.
In addition to the information offered by DANY Bourjolly-Smith in our interview, please consult what is still available online at the National Center for Biotechnology Information, which will be linked in our show notes. The original list of long-term conditions or chronic illnesses was 26. As of today, added to that list over a number of years, the list is at 77 diseases and counting. Know your numbers, know your facts, and get treated. The Sick-Witted Podcast is a Soul Sanctuary media production. For more information on our health and wellness initiative, to access the wellness providers in our digital resource guide, or to make a donation, visit us at sickwitted.net. That's sick, W-I-T, it.net. Thanks for listening. Subscribe, share, and we'll see you next time.
Oh, that's funky. That's funky. Now everybody throw it up. And now they screaming, turn it up. So I